18 children have died across Rajasthan and Madhya Pradesh because of contaminated cough syrup. Coldrif, which is a cough syrup which is manufactured by the Tamil Nadu-based Srisun Pharmaceuticals, turned toxic. Now, those doubts were confirmed when Tamil Nadu government found the control batch of Coldrif cough syrup was adulterated with 48.6% of diethylene glycol. Now, diethylene glycol is a highly toxic chemical. It's sort of a substitute for glycerin, if you will, but a much cheaper substitute and a highly toxic substitute. This is not the first time, though, that cough syrups that are made in India and contaminated by this DEG, this particular compound, they have led to deaths of children. Unfortunately, history has repeated itself both in Madhya Pradesh and in Rajasthan. Today, the Madhya Pradesh Chief Minister Mohan Yadav visited the families of the victims in Chhindwara, which is in southern Madhya Pradesh. But for the families of the children, this compensation means very little. What is 4 lakh rupees when your child is gone?
ड्रग कंट्रोलर को हटाया, डिप्टी ड्रग कंट्रोलर को भी सस्पेंड के लिए बताया है, कुछ इंस्पेक्टर ऑफ से लगाकर कई लोगों पे कार्रवाई की है। जिन डॉक्टर ने इलाज किया उन पे भी केस बनाया, जिनके दुकान से या बाकी चीज़ों को बिक्री हुई है उस सब पे भी हमने कार्रवाई की है। अर्थात कार्रवाई के पक्ष में तेरा मेरा न देखते हुए जो जहाँ जिस प्रकार से लापरवाही बरती गई वहाँ कार्रवाई भी कर रहे हैं, जहाँ समझाइश देना वहाँ समझाइश भी दे रहे हैं और जिन फैक्ट्रियों ने लापरवाही की उनको सीज भी कर रहे हैं।
Now, Madhya Pradesh's senior pediatrician, Dr. Praveen Soni, was arrested in connection with these deaths. He prescribed Coldrif to a bunch of kids and some of them went on to die. The police have lodged an FIR against Dr. Soni and the operators of Srisun Pharmaceuticals, the manufacturers of Coldrif cough syrup, under several sections of the BNS and the Drugs and Cosmetics Act. The Indian Medical Association has now come out in defense of Dr. Soni. They claim that he's being unfairly targeted and that he should not be solely held responsible for these deaths. While questioning the clean chit that was awarded to the pharma company, the Indian Medical Association has also said that it would continue to push for Dr. Soni's release. The statement said that doctors across the country are apprehensive after indiscriminate action against a bona fide doctor. It also read that once the drug has been approved and made available in the market, registered medical practitioners, it's their legitimate authority in prescribing any drug as long as that drug is legally available in the market and has not been regulated or controlled by the Drugs Controller General of India. So if the drug is available, you can't hold the doctors responsible for it. Let's listen into some more reactions from doctors and how the doctor community feels that they are being singled out and there's no action on the state government, the Central Health Ministry, or even the regulators for that matter.
Homicide. So tomorrow I prescribe a medicine, say paracetamol or anything, in all good faith, and you go and buy that medicine. It's a sealed bottle, approved by CDSCO. How am I supposed to know that there is a contaminant in that bottle? Obviously, I cannot open the bottle, drink, check, or send it to the lab for testing every bottle and then tell the patient, okay, this bottle is safe for consumption. That is not our job as doctors. Our job is to prescribe the right medication. When you have a regulatory body which has approved this combination, then I will have to accept that it is safe for the child. He was made a scapegoat, definitely. He may be working privately, though being a government servant. That is a totally different thing. You take action against him for that. But here, culpable homicide definitely is being made the scapegoat. Doctors' fraternities always made the scapegoat.
So the doctors are getting made into scapegoats and no action on the regulator, no action on the other state and central authorities. But now states are beginning to crack the whip. Coldrif is now banned in Madhya Pradesh, it's banned in Rajasthan, Tamil Nadu, Kerala, Maharashtra, Uttar Pradesh and Uttarakhand. All of this, of course, in hindsight, because after the deaths have been alerted, the DEG, which is that chemical compound I was talking about, which is a substitute for glycerin, a cheaper substitute, DEG causes kidney failure and severe harm in children. In fact, a couple of these children, the cause that's led to their death was kidney failure. The sample batches were declared as adulterated by the drug authorities. Multiple firms are involved and raw material sourcing is suspected to be the source of the contamination. States have now banned the sale and production of Coldrif to protect minors from taking it. So across the board, across batches, across the board, there's now a statewide ban on this cough syrup, Coldrif.
The Health Ministry has stepped in with strict action against the manufacturers of cough syrups after what we have seen in Madhya Pradesh's Chhindwara that has caused deaths of about 18 children. Now, after this entire incident, the Health Ministry has in fact asked all the manufacturers to follow the Special M, which is in fact a good manufacturing practice that needs to be followed by all the manufacturing units. If that is not done, if there is non-compliance, then the license of that manufacturing unit or of that pharma company is going to be cancelled. And in this case, we have seen how the Health Ministry has in fact cancelled the drug controller in fact has cancelled the license of Coldrif manufacturers, which is in fact a company based in Kanjipuram in Tamil Nadu, because their samples have in fact found to have DEG, which is an industrial solvent beyond the permissible limit, which the Health Ministry believes have caused the death of these 18 children. Now, apart from these actions that has been taken by the Health Ministry, the MP government in Chhindwara has also initiated action against the said doctor who has prescribed this cough syrup to a number of children in Madhya Pradesh. Dr. Praveen Soni has in fact been arrested by the Madhya Pradesh police, but this has set a debate in the medical industry. The Doctors Association, a number of doctors, even the IMA Chhindwara has come in support of Dr. Praveen Soni, saying that a doctor cannot be liable if a medicine has or a batch of certain cough syrup or medicine are spurious in nature or has toxic element. The responsibility of the doctor is to prescribe medicine according to the appropriate age, and that is exactly what Dr. Praveen Soni has done, is what the doctors have been saying.